Amyotrophic lateral sclerosis, ALS, generally referred to as Lou Gehrig's sickness, is a modern neurodegenerative disorder that influences nerve cells inside the brain and spinal cord. This leads to the lack of muscle manipulating characteristic, resulting in numerous debilitating signs. The disorder's exact purpose stays unknown, although a small percentage of cases have a genetic foundation. ALS often targets motor neurons, which can be answerable for voluntary muscle movements. This overview delves into the signs and symptoms, causes, chance factors, and complications associated with ALS. Symptoms. The symptoms of ALS can vary from person to individual, depending on which motor neurons are affected. Typically, the ailment starts with muscle weakness, which regularly worsens over the years. Common signs and symptoms consist of trouble strolling and appearing day-by-day sports, tripping and falling because of muscle weakness, weakness in the legs, toes, or ankles, hand weak spot or clumsiness, slurred speech and trouble swallowing, muscle cramps and twitching within the fingers, shoulders, and tongue, involuntary emotional expressions like crying, guffawing, or yawning, changes in wondering and behavior. ALS usually initiates inside the fingers, toes, fingers, or legs, after which spreads to other parts of the body as motor neurons regularly go to pot. The weakening of muscle tissue ultimately influences important functions like chewing, swallowing, speak me, and respiration. While pain is uncommon, mainly in the early years, it would not commonly impact bladder manipulate or the senses like flavor, smell, contact, and listening to. Causes. ALS goals motor neurons. Two categories of that are upper motor neurons, extending from the brain to the spinal wire and muscle mass, and decrease motor neurons, extending from the spinal cord to muscle mass. The ailment reasons each kinds of motor neurons to go to pot and die, disrupting their capacity to send messages to muscle tissues, thereby impairing muscle function. While about 10% of ALS instances are attributed to genetic elements, the cause stays elusive for the majority. Research keeps to explore the complicated interaction between genetic and environmental factors as potential reasons of the sickness. Risk factors. Several factors boom the risk of developing ALS. Genetics. Inherited threat genes account for approximately 10% of ALS instances. If a member of the family has hereditary ALS, kids have a 50% hazard of inheriting the gene. Age. The hazard of ALS rises with age, peaking among 60 in the mid-80s. Sex. Before the age of 65, barely extra men than women develop ALS. This difference diminishes after age 70. Environmental elements additionally play a position in ALS hazard. Smoking. Smoking is a long-time environmental danger element for ALS. Women who smoke, especially after menopause, face a fair higher chance. Toxin exposure. Exposure to substances like lead in places of work or houses can be connected to ALS, however no unmarried agent has been continually associated with the ailment. Military service. Studies recommend that Army provider might cause ALS because of factors like publicity to metals, chemical compounds, injuries, infections, or excessive exertion. Complications. As ALS progresses, it leads to diverse headaches, breathing problems. Weakening of the muscular tissues used for respiration is a trademark of ALS. People might also require gadgets like masks, ventilators, or even tracheostomies to useful resource respiratory. Breathing failure is the most common purpose of dying in ALS patients. Speaking problems. Muscle weak spot frequently affects speech, inflicting slower speech, slurring, and ultimately rendering speech incomprehensible. Alternative verbal exchange techniques and technology turn out to be vital. Eating problems. Swallowing muscle weak spot can result in malnutrition and dehydration, alongside an elevated threat of pneumonia. Feeding tubes assist manipulate these risks and ensure right nutrients. Dementia. Some ALS patients experience language and choice-making problems, which can be indicative of a shape of dementia called frontotemporal dementia. In end, ALS is a devastating neurodegenerative disorder characterized by way of the sluggish loss of muscle control due to the deterioration of motor neurons. While its precise cause remains uncertain, genetic and environmental elements play a position. The disorder's signs vary from muscle weakness to problems with speech, breathing, and eating. As ALS progresses, its complications emerge as more extreme, affecting various elements of a character's life. The studies network keeps to try for a deeper know-how of the disease's underlying mechanisms and potential treatments, inside the wish of imparting remedy and enhancing the fine of lifestyles for those stricken by ALS.